Now to talk more about the vaccine and its impact on children, pediatric infectious disease specialist Dr. Kainth from Cohen Children's Medical Center. Doctor, good to see you again. Thank you for joining us tonight. Let's start with what's likely to happen in the coming days here. The FDA on the verge of approving that first coronavirus vaccine for young teens. What goes into that decision and who's reviewing the data?
So the FDA reviews the data just like they do for all the other ages and all the other vaccines. We're waiting to hear about this final authorization, and it's very promising news that almost 100% of these kids were fully protected against COVID-19. And remember, we now have 22.4% of children nationally who are being infected with COVID-19. And even though locally we're seeing our numbers go down, that's because adults are being vaccinated here at high rates, and people are doing their job and wearing masks and keeping socially distant. We also have a long way to go because 22% is a high number, and we have 20% of our kids that make up the U.S. population. So we want to get them vaccinated so we're protecting everyone, not only the kids themselves, but the community members who care for those members, or who might be school staff or anybody who is in contact with children.
So Dr. Kainth, if it is approved, will those shots be available to young teens right away?
It usually would be available, as we saw, before that, as the numbers for the requirements went down, we were able to roll out vaccine for lower age groups. To my knowledge, there's no changes in the dosing for this age group, so we would be able to roll it out pretty quickly compared to how it took a little while to get the rollout started. And now that we have access to walk-in clinics and pediatricians' offices, which is different for adults, we were trying to do through the Department of Health and public health sort of authorities. Now we'll have more access other than these other ways that we've been doing it before.